The operating rooms are equipped with advanced medical equipment and technology, as well as specialized lighting and ventilation systems to ensure the safety and comfort of the patient and medical staff. During a surgical procedure, the operating theater is kept sterile to prevent infections. Operating rooms are designed to surgeons and surgical staff to perform surgical procedures that require time, patience, focus, and safety. Various pieces of equipment are required for use in the operating room. The equipments inside the operating rooms are: first is the operating tables, also known as surgical tables, are essential to any operating room. A patient lies on the operating table during a surgical procedure. The purpose of the table is to keep the patient in place while the surgical team operates and may aid in moving parts of the patient's body using surgical table accessories. Second is the anesthesia machine. Is the most important machine inside the operating room. This machine will help on providing oxygenation, ventilation, and administration of volatile anesthetics to patients to allow for otherwise intolerably painful procedures to be performed in modern day medicine. An anesthesia trolley contains drugs and anesthetic supplies essential for patient during induction for anesthesia. Third is surgical lights. High quality surgical lighting is essential for performing intricate procedure in the operating room. Surgical lights are designed to provide bright white light to illuminate the surgical site and eliminate shadows, all while keeping the surgical staff cool. The fourth is the cautery machine or electrosurgical units. Use a high frequency electrical current to cut tissue and control bleeding by causing coagulation. Tissue resistance to the high density current causes a heating effect which results in tissue destruction. Next is the suction apparatus. It is a surgical device used to remove fluids such as mucus, blood, or other secretions from a patient's airway or body cavity. It creates a partial vacuum to suction out unwanted substances, helping to maintain clear airway during surgical procedures or assisting patients who have difficulty clearing their airways independently, and to suck blood, fluids, and other secretions to make the operative site clear and easy visual of tissue during the surgery. The fifth is laparoscopy tower. Is used for minimally invasive procedures with small wound incision made in the skin and using the scope and camera connected to the laparoscopy monitor to visualize the organs that requires surgery or reconstructions. How to prepare the operating room for surgery. As an operating room nurse, one of the most important parts of our job, aside from excellent patient care, is to ensure that operating theater is at the safest environment and most sterile equipments and instruments prepared and ready for surgery. Because an operating room that hasn't been fully prepped for surgery can pose unnecessary risk to the patient. So, how can we quickly and efficiently prep this operating room for surgery? Here's everything you need to know. First is cleaning. The operating room itself should be uncontaminated and dust free. Early morning, the OR nurses team must damp dust horizontal surfaces prior to first cases. Use a clean, lint-free cloth moistened with Environmental Protection Agency disinfectant approved by the hospital. Clean and disinfect the following. Start at higher surfaces and work down in a clockwise manner. All flat surfaces, wipe from top to bottom, then from the center outwards. Operating room overhead lights and overhead cameras. The patient OR table and its attachment, positioning devices, and patient's transfer devices. All machines and equipments needed for surgery. Tables for sterile instruments and Mayu trays, cabinets where sterile softwares are kept, trash bins and linen trash bins, and making sure that they are empty. Second is OR machines and equipments functions. Preparing operating room surgical equipments and medical equipments before doing a surgery is important for several reasons. Firstly, Proper setup and positioning of the equipments and operating table is crucial to ensure a smooth and efficient procedure. Secondly, proper equipment setup is important to ensure availability, functionality, and familiarity for the success of the surgery process. Third is positioning devices needed for surgery. Positioning patients properly in the operating room is critical to providing the best care possible and protecting against complications such as pressure ulcers and nerve damage. These preventable injuries can be devastating to the patient and have significant consequences. So, positioning devices should be readily available inside the operating room to avoid delays of surgery and to properly position the patient for better incision exposure and for easy access for anesthesia team. Lastly, is instruments, software, and implants preparations. Having all the necessary instruments and sterile supplies and implants ready and available and in good and functional working condition is essential to avoid any delays or complications during surgery. Checking the availability of the instruments and implants to be used for surgery per doctor's preference is beneficial for the success of the surgery and for patients' rate satisfaction. Overall, taking the time to properly prepare the equipments beforehand helps to ensure the safety, efficiency, and success of all surgery process. Safe positioning of the patient for surgery in the operating room is the shared responsibility of the surgeon, anesthetists, and OR nurses, and making sure that the patient is positioned properly, comfortably in anatomical position, and depending on the surgeon's preferences, and safely attach the padded safety strap to the patient in the middle thigh and arms to prevent injury resulting from falls. All safety equipments attached to the patient should be padded and secured. Always involve the anesthesia team in positioning for good airway access. When we are using the electrosurgical pencil during the surgery, be very mindful to attach the grounding pad to the patient. The grounding pad adhered to the patient's skin away from the surgical site is intended to safely return the electrical current from the patient back to the generator through a cord or cable. This is to protect the patient from burns during the surgery and making sure that the skin of the patient is not in contact with the metal. As you can see in the image, the generator or the cautery machine is eliciting active electrical current to the pencil to cauterize the tissue to prevent bleeding. Then the electrical current will return back to the grounding pad, then to the machine. Duties and responsibilities of OR nurses. As a scrub nurses, firstly check and prepare necessary instruments and make sure they are sterile with no breaks of wrappers integrity, software availability, and working with surgeons about specific instrument systems and implants to be used. Secondly, do surgical hand scrubbing, maintaining sterility, and assist the surgeons with drapings, instrumentations, suturings, and dressing. Thirdly, initiate proper and correct surgical counting of sharps, sponges, and instruments with a circulator. Next is to document or receiving circulating nurse 1. Receive and do proper and correct checking of patients' important data from ward nurses or DSU nurses following the 6 International Patient Safety Goals. Help with the rest of the surgical team inside the operating room during the intraoperative period. Initiate proper and correct surgical counting of sharps, sponges, and instruments with a scrub nurse. Endorse patient properly to the recovery room nurse using S-bar. Next is the circulating room nurse 2. Provide additional supplies and sterile instruments as needed during the operation. Assist other team members in monitoring the status of the patient and helping with the patient's skin preparation, positioning before and during the procedure. Help with the team on doing aftercare of all the instruments and software not used and initiate on cleaning the room, OR tables, equipments, machines in between cases, and do preparations for the next surgery.